Medical coding translates healthcare diagnoses, procedures, medical services, and equipment into universal alphanumeric codes. These codes are derived from medical records, including physician notes, lab results, and radiologic findings. Medical coding ensures uniform documentation of medical care. Universal alphanumeric codes facilitate efficient data processing and analysis in healthcare management. Standardized coding enhances interoperability and data exchange between healthcare providers and institutions. Medical coding is essential for precise billing and reimbursement processes. Insurance companies utilize standardized codes to accurately determine payments to healthcare providers. Accurate coding ensures healthcare providers receive appropriate compensation for the services they provide. Proper medical coding supports data collection for research and public health monitoring. Standardized medical codes facilitate consistent data analysis and reporting across healthcare systems. Medical codes are standardized systems for classifying diagnoses and procedures. ICD, International Classification of Diseases, is maintained by the WHO for classifying diagnoses. CPT, Current Procedural Terminology, is maintained by the AMA for reporting medical procedures. HCPCS, Healthcare Common Procedure Coding System, includes CPT codes. HCPCS includes additional codes for services like ambulance rides. These coding systems ensure standardized reporting and data collection in healthcare. The medical coding process initiates with a thorough review of clinical documentation. Clinical documentation includes physician notes, lab reports, and discharge summaries. Key information such as diagnoses, procedures, symptoms, and medications are identified and extracted. The extraction process involves identifying relevant data points within the clinical documentation. Clinical documentation is reviewed by coders to extract relevant information for coding. Coders assign appropriate codes from ICD-10, CPT, and HCPCS coding systems. Coding manuals or specialized software are used to facilitate the code assignment process. Assigned codes are validated for accuracy to ensure correct billing. Compliance with payer guidelines is checked to prevent claim rejections. Validated and compliant codes are submitted for claims processing. Medical coders are trained professionals possessing knowledge of anatomy, medical terminology, and disease processes. Effective medical coding requires a thorough understanding of established coding guidelines. Attention to detail is a crucial skill for medical coders to ensure accuracy and compliance. Critical thinking enables medical coders to analyze complex medical records and apply appropriate codes. Familiarity with electronic health records, EHRs, is essential for efficient and accurate medical coding. Certifications like CPC and CCA are highly valued in medical coding. These certifications demonstrate knowledge and proficiency in medical coding practices. Medical coding certifications, while not always legally required, enhance professional credibility. Maintaining certifications requires ongoing, continuing education to stay updated with current coding standards. Medical coding is challenged by frequent updates to coding systems. Incomplete documentation from healthcare providers poses a significant obstacle to accurate medical coding. Variations in insurance payer requirements add complexity to medical coding processes. Healthcare organizations must manage audits to ensure compliance with coding regulations. Compliance is essential to avoid legal penalties and financial repercussions. Automation and AI are shaping the future of medical coding by improving speed and efficiency. AI assists in automating parts of the medical coding process. Human oversight remains critical to ensure accuracy and compliance in automated medical coding. The integration of AI in medical coding enhances workflow and reduces manual effort. The balance between automation and human expertise is essential for effective medical coding. Medical coders are increasingly vital in data analytics as healthcare transitions to value-based care. Coded data is used by organizations to improve healthcare outcomes and operational efficiency. Precise documentation and coding are essential for evaluating healthcare outcomes and quality. Accurate coding supports better healthcare delivery for all patients. Value-based care relies on data analytics to optimize resource allocation and enhance patient experiences.